In this clip, we'll talk about what a family member can do to help a person who's suffering from OCD. One of the main things you're going to want to know as a family member is, what can I do to help? And one of the answers to that question is, get informed. Learn what OCD is. Learn what some of the things are that you can do. Kind of inform yourself as to what kind of treatment your family member is receiving. Now, if they're not even receiving treatment, then one of the things you can do is help them figure out if treatment is necessary. And if they have OCD, the answer to that question is yes, they do need treatment. If they're open enough to have you go with them to the doctor, it's helpful because you will be able to provide a different perspective on what is going on with that person. You know them, you love them, you may be able to tell them what are some of the things that you've noticed trigger some of their behaviors. You might have a better, especially if you're a parent, you might have a better knowledge of their medical background, any kind of major events. Again, OCD can be caused by a lot of different things, biological, environmental. Especially if it's an environmental trigger, you're going to be able to help them because you're going to notice a lot more of what's going on in their environment and around them. Again, it's not caused by a specific traumatic event like PTSD is, but by other factors. And as a family member, you might need some support as well. So make sure that you're helpful, but not to the point that you're trying to take control or becoming overbearing, because one of the main things about OCD is that the individual loses every sense of control that they have, or they have very little control. So actually, if you take over and you try and take control from them, you might actually worsen their symptoms. So be there, be loving, be supportive, get informed, and listen to them. Those are the things that you can do to really, really help a person who you love or care about that has OCD.